Hi, Dr. Tan.
Hello.
What are the parameters for a female to be eligible for cryopreservation of oocytes and ovarian tissue, and how much does it cost?
Thank you for the question. Oocyte cryopreservation and ovarian tissue cryopreservation are done under anesthesia. So it's considered a surgical procedure before we actually freeze or cryopreserve the tissues and the oocytes. So the woman has to be deemed healthy to be able to tolerate the surgical procedure and the anesthetic. They, preferably for better outcomes, they should be in the mid-20s to about 35 years old to have very good outcomes from the cryopreservation. Their tissues are young and healthy. So the yield of embryos from these tissues are higher when they're done at those age groups. And as far as cost is concerned, the oocyte cryopreservation would be roughly $180,000. That includes already the medications given to stimulate the ovaries, produce a lot of eggs, and the process of harvesting the eggs, as well as the freezing procedure as well. And for the ovarian tissue cryopreservation, because it's done in a hospital setting where you retrieve the eggs operatively, either laparoscopic or a small mini laparotomy incision, the cost will really depend on the hospital where you have it done. But the range, more or less, would probably be the hospital costs plus the cryopreservation cost, which is somewhere around 130,000 pesos. So I would say maybe 230,000 for the ovarian tissue cryopreservation.
Okay, thank you, Doc.
Thank you very much for having me. All right.